Michael, I'm curious, where did the whole thinking come from about these sort of at the molecular and cellular level, these sort of differences in impedance or electrical? How did this all evolve?
Sure. You know, when our scientists started looking at this problem, and the founder of the company, this was probably about 11 years ago now, before the company was incorporated, was talking to surgeons about problems that they were having and what might he be able to address.
Right.
The problem of breast cancer margins came up over and over and over again. So we started digging into what's the research out there, what science is available to help us come up with a premise of how we could address this. And what he was interested to find was that there was over 30 years of electrical engineering literature on the electrical differences between healthy and abnormal breast tissue. In the electrical engineering space, they've been looking at this. They've been measuring parameters such as conductivity and permittivity and seeing those differences. What was interesting was those groups had done it in a lab scale, but had really never, their data from one lab to another lab could never be compared because the test rigs were different and there was differences in the way that they had gone about taking their measurements. So they looked at it and said, you know, if we could create a repeatable, reliable way of taking this measurement, then we might be able to create an algorithm that could track those differences. So that was really the challenge of the development of the device.
Okay. And that same group of scientists is still together today, or?
Yes, they are.
And anything else you want to share with us about the sort of work they're doing as well and their sort of futuristic thinking?
Well, you know, I think that their ability to apply some of these concepts to really interesting clinical problems has been just absolutely top shelf. I've worked with a lot of scientists in my career, and I'm continually amazed by the creativity that they're bringing to us. So I'm very excited about the prospects of what we can do both with this technology and as it grows out.
Okay, very good.